Hello, I'm Dr. Michael Baker, co-head of the Emergency Department at Perth Children's Hospital. Keeping children and families safe when they come to Perth Children's Hospital is our top priority. To do this during the COVID-19 pandemic, we've introduced some changes based on the latest health advice. Here at PCH, we'll continue to provide emergency care to any child who requires it during the pandemic. If your child needs an urgent medical assessment, you can take them to your nearest emergency department, as you normally would. Or call 000 if it's a life-threatening emergency. We understand that coming to emergency is stressful for parents, so we want you to know what to expect. Before you come inside, our team will run through the required checks at our screening booth. We will also give you, and your child where possible, a surgical mask to wear. An emergency department nurse is part of the team to ensure we prioritise any children with urgent medical needs. If you or your child has any COVID-19 symptoms or risk factors, we will take you to a separate part of the emergency department for your care. This area has been especially set up to keep everyone safe from the risks of COVID-19 transmission. For everyone else, you will go through to our normal waiting areas and assessment zones. You or your child may have a rapid antigen test, or RAT, if either of you meet the testing criteria. It's a simple process. A nurse takes you to a private booth where the nasal swab is done, and it takes about 15 to 20 minutes for a result. This won't slow down your treatment, but it will help us decide the safest way to care for your child. Within the hospital, we have excellent processes to safely manage any child with COVID-19. Our staff are well trained and will be wearing full personal protective equipment, or PPE. We also have special teams in place to help manage any COVID positive or suspect patients, especially if they are moving between hospital locations. HEPA filters are now located across the hospital, which are air filters which help to clean the air. And cleaning has been increased to ensure the hospital environment is safe. We also have dedicated patient rooms and areas that are set up to minimise the chance of COVID-19 transmission. At PCH, we are ready to care for all children and families who need us in a COVID-safe way. You can help us during your visit by following any instructions given by staff, by wearing your mask properly, and by washing your hands frequently. Our staff and volunteers are committed to the health and well-being of the children of Western Australia, so we will get through the pandemic together.